Hey everyone, in this lesson we're going to talk about Chagas disease. So what is Chagas disease? Well, Chagas disease is a disease caused by an infection with a parasitic protozoa known as trypanosoma cruzi. Now, the trypanosoma cruzi protozoa is transmitted by an insect of the Triatominae subfamily, and this insect is informally referred to as the kissing bug. And here's a picture of the kissing bug. And the way that the Trypanosoma cruzi protozoa is transmitted from the kissing bug to a person is through the fecal material of the kissing bug coming into contact with the mucosal membrane of the person. Now, it's estimated that about 6 million people are infected with Chagas disease. And interestingly, it constitutes the highest parasitic disease burden in the Western Hemisphere, even more so than malaria. And here is the estimated range of Chagas disease. Anywhere from Mexico or northern Mexico, and some estimates even say parts of southern United States, all the way down to Argentina. This is the range of Chagas disease. So what are some of the stages of Chagas disease? Well, we mentioned that the kissing bug, or the tryptamine bug, infects an individual through fecal material. And I didn't mention, though, that the tryptamine bug actually will bite an individual first, and then will usually defecate, leaving fecal material behind, which then carries metacyclic trypomastigotes. And these trypomastigotes can then enter the bite wound itself, or will enter mucosal membranes such as conjunctiva of the eyes. So when a person perhaps wipes their face, if there's any fecal material on their face, that fecal material can enter into a mucosal membrane such as maybe the mouth, the nose, or the eyes, and usually it's the eyes. And once that occurs, we have metacyclic trypomastigotes penetrating into various cells in the person, either again at the bite wound site or in the mucosal membrane. Once these metacyclic trypomastigotes enter inside the cells, they transform into amastigotes. And the amastigotes can multiply by binary fission in cells and infected tissues. Now, these intracellular amastigotes can then transform into trypomastigotes, which can then burst out of the cell and enter the bloodstream. So after the trypomastigotes burst out of the cell and enter the bloodstream, they're in the general circulation, they can infect other cells and transform again into amastigotes, and they can again multiply in other tissues. Or when these trypomastigotes are within the bloodstream, if that person or that patient comes into contact with another tryptamine bug, that bug can take another blood meal and itself become infected with the trypomastigotes. Once that tryptamine bug actually ingests those trypomastigotes, epimastigotes are formed within the midgut. So the trypomastigotes become epimastigotes within the midgut of the tryptamine bug. The epimastigotes then multiply within the midgut, and then once the trypomastigotes or the epimastigotes enter the hindgut of the tryptamine bug, they become metacyclic trypomastigotes. And after they are in the hindgut, once they are removed by defecation by the tryptamine bug, again, this cycle can continue, and another individual can be infected by these metacyclic trypomastigotes in the feces from these bugs. And that continues the cycle. Now, there are a couple specific characteristics of the tryptamine bugs. One is that they typically feed at night. So if someone's sleeping outside, the tryptamine bug will typically bite the face of an individual. That's why they're called the kissing bug. And then they will defecate, and then that can lead to an infection in an individual. The bugs themselves become infected when they feed on a person or an animal that's infected with the Trypanosoma cruzi protozoa. And then, like we said, they can continue the cycle by transferring the Trypanosoma cruzi protozoa in their feces to a non-infected person or animal. Now, with regards to infections in humans, humans can be infected by other means, and one way is through blood transfusion. So you can imagine that if an individual that's giving a blood transfusion has trypanosomes within their blood, they can transfer the trypanosomes from their blood to another person through a blood transfusion or from blood-to-blood contact. Another way for humans to be infected is through oral ingestion of the trypanosoma cruzi, usually through oral ingestion of fecal material of the triatomine bug. When an individual is first infected with Chagas disease, there's an incubation period of around 1 to 2 weeks. And after that, there's something known as an acute phase, which lasts about 8 to 12 weeks. Now, during the acute phase, an individual can experience what is known as severe acute disease. And this typically only occurs in less than 1% of patients, where these patients will experience acute myocarditis, pericardial effusion, and meningoencephalitis. So it's pretty severe. And this severe acute disease usually only occurs in individuals that have been infected through oral transmission. So again, as we mentioned before, through an oral ingestive process. Now, when an individual first becomes infected, there is something known as a chagoma. And the chagoma is something that occurs at the site of infection. And there's also something related to chagoma known as Romagna's sign. So a chagoma is the swelling of the first initial swelling of the site of infection. So as I mentioned before, usually individuals can be infected in the conjunctiva of their eyes. So when someone wipes their face or wipes the fecal material of the triatomine bug into their eyes, it can lead to a swelling, and that swelling is known as a chagoma. And Romagna's sign is when both the upper and lower eyelid are swollen, and that is known as Romagna's sign. Now, other than that, most individuals during the acute phase are asymptomatic, but some other patients experience non-specific symptoms such as fever, lymphadenopathy, myalgia, and headache. So it feels like a general illness. So once we pass the 12-week mark of the acute phase, we enter the chronic phase of Chagas disease. And individuals suffering from chronic Chagas disease are considered to have Chagas disease for the rest of their life if they never get treated for it. And about 20 to 30% of individuals progress to Chagas heart disease or GI disease by 10 to 30 years. So these patients can experience symptoms of Chagas disease after a prolonged time. So even after 10 to 30 years of being infected with Chagas disease, you can have problems with your heart or problems in the gastrointestinal system. So it's a very chronic and very progressive condition. Now, with Chagas heart disease, or otherwise known as Chagas cardiomyopathy, it's considered a biventricular heart failure. It can lead to arrhythmias, thromboemboli, ventricular enlargement. It can lead to sudden cardiac arrest. And symptoms of Chagas cardiomyopathy include dyspnea, fatigue, dizziness, syncope, and chest pain. And here's the heart of an individual with Chagas cardiomyopathy. Now, with regards to the gastrointestinal disease as part of Chagas disease, or Chagas gastrointestinal disease, it is an immune-mediated tissue damage. So the immune system becomes activated and literally damages the gastrointestinal tissues of the patient. It leads to denervation of the Meissner and Auerbach's plexuses. And it leads to, in patients during the acute phase, they can have acute symptoms such as dysphagia. They start with solids or dysphagia for solid foods, and then they progress to dysphagia for both solids and then liquids. Patients also have abdominal pain and they also have diarrhea. Typically, gastrointestinal disease only occurs in the chronic phase of Chagas disease. We start to get esophageal involvement, so esophageal involvement such as, again, dysphagia, so it acts as an achalasia in patients, and there are also involvement of other areas in the gastrointestinal system such as colonic involvement, stomach, small intestine, biliary tract, and salivary glands can all be affected in Chagas gastrointestinal disease. And I'll briefly mention that in mothers that are infected with Chagas disease, they can pass it on to their baby after birth. So about 1 to 10% of infants of infected mothers become infected with a congenital Chagas disease. Most are asymptomatic, but some symptoms of congenital Chagas disease include low birth weight, so usually less than 2,500 grams. Anemia can be another symptom, and hepatosplenomegaly is another symptom in infants infected with congenital Chagas disease. So this is just a brief overview of some of the different conditions related to Chagas disease, but I will probably get into these conditions in another lesson. So I'll discuss Chagas cardiomyopathy, gastrointestinal disease, and congenital Chagas disease in another lesson, because this is just a brief overview of these conditions. Now, how do we diagnose Chagas disease? Well, diagnosis occurs through microscopy, or can be diagnosed through microscopy. And this usually occurs in the acute phase when trypanosomes are high. So trypanosomes are high during the acute phase, but the trypanosomes themselves will start to decrease by 90 days. So that renders microscopy very ineffective later on. Now, diagnosis can also occur through polymerase chain reaction, or PCR. And again, this is most helpful during the acute phase. When trypanosomes are high, there's more trypanosome DNA to utilize in the polymerase chain reaction. And hemoculture can also aid in diagnosis. So you can literally culture the blood of a patient to assess whether there are trypanosomes within the blood. So once we've diagnosed Chagas disease, how do we treat it? Well, treatment involves anti-trypanosomal medication. And some of the anti-trypanosomal medications include benznidazole. Benznidazole is the first-line treatment because it is well tolerated, or better tolerated than other treatments. The other treatment is nifurtimox. Nifurtimox is another treatment for Chagas disease, but again, benznidazole is a better treatment because it's usually better tolerated, and that's why we use benznidazole as a first-line treatment. Anyways, guys, that was a lesson on Chagas disease. I hope you found this video helpful. If you did, please like and subscribe for more videos like this one. And as always, thank you so much for watching, and I'll see you next time.